What is the difference between a clinician fresh out of dental school and a key opinion leader? Truth is, not much. Hold on, I'll explain. The passion and the commitment is the same for both. The difference is the stage they are in their careers. On this note, I had the pleasure to welcome in our headquarters in Switzerland the amazing young clinician Dr. Maja Chmielewska from Poland. And we talked about the touch points digital technology is present in her daily work and how she balances work-family life working in the same clinic as her father does. And what young clinicians should focus on if they aspire to become an international speaker like she is. Stay tuned, I'm Dr. Christian Jarry, and you're watching Straumann Open Mic. First things first, you graduated as a dentist, and at some point, surgery and dental implants became part of your daily life. How was this path for you?
Well, my dad is a dentist and a very good one. He's also an implant surgeon. So I kind of got infiltrated with all that, smile clinic and dental office vibe since I was a kid. I remember going to the dental office and asking the assistants if there are some drills that I can put on the trays and, sterilize stuff. I really liked it. And it became kind of natural. So, I grew up around my dad being also my mentor and my best hero, I would say. It kind of became natural.
We see a great predominance of other specialties like ortho, aesthetics, cosmetic dentistry being mainly populated by female dentists. And you shifted towards surgery. That was inspired by your dad?
Actually, my parents never pushed me to be a dentist, which I really appreciate. So they didn't tell me, but they had a plan B, like what if I will go for, I don't know, arts or something else that they didn't think as, let's say, a great self-sustaining business. But I always wanted to be a surgeon, and I have a few doctors in the family, so I figured out that, working in a hospital isn't necessarily going to give me a chance to have a life. Dentistry is very good at that. Like, yes, we overwork, and yes, we do too much stuff, but at least you have a chance of having work and life and vacation sometimes, or enjoying it. Yeah.
I know you have a great example at home, and we're all big fans of Dr. Chris Chmielewski. But how do you keep this healthy relationship in a family-based business? And honestly, do you do the same things? Are you both surgeons, or is it more of a complementary surgery restorative role? You exchange interdisciplinary roles?
Yeah, work with family is not easy. And we love each other a lot. We're very supportive toward each other, and my dad has always been my personal hero. But the first 2 years, it was really tough since we needed to figure out how to communicate and how not to blend the family life with the work life. Especially that we have very different characters. And my dad is this kind of army general, and I'm this kind of in order to remember something, I need to understand why. And I always go around asking why. So as you can imagine, that wasn't the perfect mix. But we figured out our way into communication, and also our way in the dental office, how to function and how to not blend it too much with family, let's say. So I would never swap it for anything else, and this is great. And yes, we both do the same thing, which isn't making it necessarily easier, as you can imagine. Especially that, my dad is very well known, and I also have a lot of pressure, let's say, to step up to him. At the same time, I really love periosurgery too, so I do more soft tissues a little bit than him. And he has taken over all the big and tough surgeries, and I'm learning them with him and doing all the, let's say, less complicated ones, or maybe aesthetic cases also, or so the horrible cases he's getting.
I see. Okay, so today is about you, and you are a bit
a big advocate and a big ambassador of digital technologies. And I'm curious, what are the touch points? I mean, how present digital technology is in your life? And what are the touch points that today your daily work cannot be without? For example, planning, surgery, restorative.
For us in the clinic, it's very important to have this kind of workflow with digital tools, because it just helps us to monitor the patients better and to have the workflow smooth. If we want to do any surgery, by the decision also of my dad, and I think that's a very wise decision, with all his experience, he decided, I think around 7 years back, that every single surgery that we do is going to be guided surgery. So there's no guide, there's no surgery, so simple. And I think that's a very responsible take, because even though he has all the experience and he could, say that he doesn't need it or whatever it would be, his center of attention, and also that's the mindset of our clinic, is always the patient. So I know I'm still human, and sometimes we just have a bad day or didn't sleep enough or have some stress or whatever happens. I really think it's more responsible for our patients if we do use those tools. Since they are there, they're helpful for us, and I think that's the only responsible way for helping the patients, let's say, and fair to them also.
I agree with you completely. We had an open mic previously with Sonia Lazy, and she was very open. She says, I brag myself being an experienced clinician, but we have to admit that sometimes our brains are not so well connected to our hands. And there are so many small mistakes that we can introduce as the human factor, that digital technology can be an ally to mitigate any potential mistake. I see it the same way. It brings precision, efficiency, and at the end of the day, we want to deliver best care possible. Let's change gears a little bit. We all choose dentistry because we want to do good to people. So we want to have a positive impact treating people directly. However, we also choose to do good to people helping our peers by being present on stage and sharing your experience with them. And you chose also at a very young age to not be present completely in the office, which is in the way where our income comes from, because the main source of income comes from the office. So you chose to step out of the office to a certain percentage to be on stage sharing your experience with people. What was the turning point for you to be on stage as well and decide to be sharing your expertise with others?
First lecture I ever had was on a Polish ITA study club for dental assistants. So I was trying to help them out navigate through the tools for implant surgery, let's say, or why we need certain things to be done certain way. And then I remember I got a chance to be on the WIN symposium, the first one in Malta, and it was an amazing congress. It was really a stunning experience, and also out of the cool stuff, I got my mom to be there with me, so I had my best support, also there. And that was the first international congress that I've been to, and I would say from that things started. And just to also say, like, when you start presentations, you need to understand that the first ones that you're going to start with are the shortest ones, and that's usually 10 or 15 minute long presentations. But the funny thing is, of course, because nobody is going to give you more airtime in the beginning, like you have to show what you're made of and what you have to say. But at the same time, that's out of all the formats that I've been through and all the 3-day courses and longer lectures and everything else, the 15-minute presentations are very often the most challenging ones, because you have to really know what you're saying and really be able to put some meat in the presentation that will be valuable for someone, but at the same time you can't drag on the topic, and this is a very challenging format to do. So yeah, I would say that's the start. That's how it all started.
I hear on that point of the timing. Winston Churchill used to say, if you want me to speak for 4 hours, I'm ready. If you want me to speak for 15 minutes, I need a day to prepare. You know, at Straumann, and you brought this a few minutes back, at Straumann we believe education was, it is, and it will always be key to professional development.
Yeah.
And today, education is also going through several changes, digital revolution. How is your learning method today? What do you take to develop and to keep up to date?
Yeah. To be honest, the most humbling experience and where I really learn the most is when I try to explain to somebody else. That's why education is so powerful, because also for me, being on stage or doing the hands-on courses, that's what really helps me to develop. Because if you need to explain how something works to another person, that's when you learn the most.
A lot of courses and trainings became virtual. And today, to which percentage you think you go more to physical events and virtual events?
I think there are valid contents which I can learn online. That also being, for instance, practice management and business development, stuff like that. But there are also things that I have to do with my hands. So yes, I can listen on the symposiums, and that also gives me the right directions maybe to what's my next step on education. So I also go for symposiums to just have a look at which courses I want to go for. Because when you look at those people on stage, they usually also run courses on site. Very often they have hands-on courses. And if you hear that somebody really explains in a way that you understand and you know that you need to catch up on this kind of skill, maybe it makes sense to go for their courses. As simple as that. So I really appreciate hands-on, and I think there is always going to be space for that. And there is always going to be space for the most unappreciated, let's say, thing in the symposiums and all the meetings and congresses that we have, which is networking.
Exactly.
So you can't take that away, because yes, I can learn online many things, and webinars also help me learning. I really love the e-learning platforms when I can re-access content whenever I need it, especially when something is technical, like dental photography, for instance.
You were at IDS recently, and you had the chance to experience the virtual reality, which we think it's an incredible tool. But we saw your social media post about it. It was quite fun. How your feedback on that? How was the experience? We think virtual reality can be a great asset to staff, to team members that they're new to clinical environment. They have to learn about the steps of the workflow before helping in a practice. How do you see it?
I would say, we are surrounded by technology. And I think in dentistry, we're quite a bit behind. If you look at medicine, they're using guided surgery already for a long time. They're using robots for surgery, right? And we are still stubborn enough to say that I don't need that. Come on. Of course you need that. Would you like your neurosurgeon to be using those kinds of tools, or would you rather if he just comes today as he woke up and, do his operation on you, right? So I think we owe that to our patients, and I think there's a great bunch of technology that we can utilize for our development and learning. That also being tools like dynamic guided surgery and AR, so augmented reality, and also VR. So VR, I think the great part of VR is not going to be only that, okay, I have a procedure recorded and I can check if I cut the tissue here or there, but I would say it's going to be really useful for the stress management part, when you feel like you're in that situation and now you have to manage, so that you also know your response. Because very often we don't know our responses. And this is also, if you go for a resuscitation course, this is also what you're learning about yourself, like you go for those courses, theoretically how to help, and then you encounter somebody that fainted on the road and you're like, what do I do now, right? So this is the kind of situations that I'm thinking about. And AR, I think, is also very valid because, well, our patient is real, they're not in the virtual world. So there I would say it makes more sense to go with AR when we can just use a little bit the extra benefit of having a live view of the X-ray, or having our surgical protocol just here in space for work ergonomy simply. So that we can, let's say, adapt our workflow better, be more efficient at work, and yeah, I think there is a lot of space for that.
Cool.
Yeah.
Maja, we could pick your brain for a full day, but unfortunately our time is up. And thank you very much for coming, for spending time with us, sharing your journey, your family activities, your inspirations, and how you're really an inspiration to others. Thanks for stopping at Open Mic to spend time with us.
Thank you very much, Christian.